Hello, everybody, and thank you for joining. We're just going to give folks a few minutes to get on here and then we'll get started. Welcome and thank you again for joining us for this webinar about the WACARES Fund. Today we will be covering the basics of benefits. My name is Sam and I am the WACARES Fund Communications and Marketing Manager. I will be hosting today's presentation. Let's take a minute to meet the panel. Sebastian?
Good morning, everyone. Thanks for joining us. I am Sebastian Kahe, he, him, L pronouns, and I am the Outreach and Language Access Lead.
Maria?
My name is Maria Mungarro. I use she, her, ella pronouns. I hope I didn't freeze there for a second. I am the eligibility program manager here at Walkers.
And Debbie?
Hi, I'm Debbie Blackner, and I am one of 4 provider network capacity program managers here at WellCares Fund, and I use she, her pronouns.
Oh, looks like it's me. Hi, everyone. My name's Janice Tadeo. I use she, her pronouns, and I'm the Benefits Authorization Program Manager.
Thank you. And the WACARES team Benefits and Customer Care Center will be answering questions in the Q&A function during the presentation and will be able to answer your questions in chat. Anyone who's joined us on a computer or using the Zoom app on their phones can submit a question through the Q&A function at any point during the presentation. If we are unable to answer your question during the allotted amount of time, you can email us your question using the contact form that I'll put in chat. This webinar will be recorded and the recording along with the slides will be available on our website within 24 hours of the completion of the presentation. Now I'll pass it to Sebastian to start the presentation by talking about long-term care and how the program works.
Thank you, Sam. And good morning and welcome again, everyone. Thanks for joining us. Before we do jump into long-term care and talking about how the program works, I do want to start with just a couple questions just to get a sense of your all's experience with long-term care, maybe caregiving, as well as the program. So starting with how familiar you all are with long-term care or caregiving. If you all could give me maybe a thumbs up or some sort of emoji there, again, just to get a sense of how familiar we are with that topic. All right, seeing lots of thumbs up come up through there on the screen. Excellent. So some of this information may be familiar to some of you, or a good reminder. And would also like to ask you all to raise another thumbs up or emoji for to see if you have heard about the Walk Cares Fund before and are at least somewhat familiar with the program. Awesome, excellent. Yeah, seeing a lot more thumbs up and hearts, so that's great. So yeah, let's go ahead and jump into talking about long-term care and how the Walk Cares Fund works. So a program like Walk Cares is needed because the way we have paid for long-term care up until now isn't working. So we know that about 70% of us will need long-term care at some point in our lives, but most of us can't afford it. We see under that the cost of 20 hours of home care per week is just over $23,000 for 6 months. And additionally, other types of long-term care are more expensive. But the median household income for Washington seniors is just 69,000 per year, right? So that's a big chunk of that income. So in order to fill that gap, family caregivers have to step in, and that can be with their own savings or by providing unpaid care. I'm gonna just quickly stop sharing. I just got a message that maybe my screen isn't sharing, so let me just quickly stop sharing and reshare. Hopefully that will fix it. Sorry about that. Let me try that again. Okay, hopefully you all are able to see my screen there. And if not, let me know and I can try that again. Okay, great. Excellent. Sorry about that. It said it was sharing, but I guess not. Um, so I was saying that family caregivers have to step in to fill that gap, right? And that can be with their own savings or by providing some of that unpaid care as well. But that, of course, has a big impact on the caregiver. So almost half report a related financial setback and spend an average of 25% of their own income on care-related expenses. Many also have to leave the workforce early to provide care, and we know that caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. Businesses and the economy more broadly are also impacted. So most caregivers work full time, and 61% of working caregivers say that their care responsibilities have impacted their job in some way. So that can be maybe having to come in late more often, leaving early from work, maybe reducing even the amount of hours, right, or turning down a promotion, quitting, or retiring early as well. And when a working caregiver leaves their job, it can cost 1.5 times their salary to replace them. So jumping in next to talk about how the program works. So to earn benefits, you automatically contribute 0.58% of your paycheck during your working years, and you only contribute while you're working. So if when you retire, let's say, or if you become unemployed, then contributions stop. And everyone is covered at the same low rate regardless of any pre-existing conditions. So starting in May of 2026, you'll be able to apply for benefits. You'll need to meet a contribution requirement and a care needs requirement, which we'll talk about here shortly. Once you're approved, you get to choose how you want to use your $36,500 benefit. That benefit amount is a lifetime benefit amount, and that grows with inflation each year. And you can choose any covered services that you want. That's something that the benefits team will cover in more detail later on as well. And there are no out-of-pocket costs when you need care. So we pay the providers directly for the services that you receive with no copay or deductible. So everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. So to qualify for benefits, you have to meet one of the three or meet the contribution requirement through one of these three pathways that you see on your screen. So we have the permanent pathway on the left there, which will earn you the full benefit amount by contributing for at least 10 years, and that is at any point in your career. Then we have the temporary pathway, which earns you the full benefit amount if you've contributed for at least 3 of the last 6 years at the time that you apply for benefits. And then the third pathway is the transition pathway. This one earns you lifetime access to 10% of the full benefit amount for each year that you contribute if you were born before 1968. Anyone who qualifies through this pathway can also earn the full benefit amount if they qualify through one of the other pathways as well. So, for example, if someone or you work and contribute for at least 500 hours per year for 2 years, and you were born before 1968, you'd earn 20% of the full benefit amount, which comes out to $7,300. If that person retired, let's say, but then continued working maybe a part-time job after retirement and was contributing at least 500 hours per year, they could still be earning benefits, right? And could work their way to qualify through, let's say, the permanent pathway or the temporary pathway as well. So this is just to get a sense of what contributions look like over the course of a career. I mentioned, right, that contributions are 0.58% of every paycheck. So for a worker who earns about $59,000 a year, they pay $29 in contributions per month. And that adds up to just over, as we can see there, $10,000 total over a 30-year career. So in order for someone to earn less in benefits than they contribute, they would have to make an average of $210,000 each year over the course of 30 years. So to use your benefits, we must determine that you need help with 3 or more activities of daily living and will continue to need help for at least 90 days. So the activities we assess are the ones you see on the screen there: bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And if an applicant requires supervision with an activity of daily living due to cognitive limitations, so monitoring, queuing, or setup assistance, that counts as needing support with that activity of daily living. And that way, this ensures that we are also capturing not only folks with functional limitations, but also those with cognitive limitations. So when you're ready to apply for benefits, you'll start by creating an online account. You can have someone else help manage your account, and your local area agency on aging will also be available if you need additional support as well. So once you submit your application, we'll confirm if you've met the contribution requirement, which we just looked over. Then you'll be able to schedule an appointment to talk about your care needs. And after we meet with you, we'll let you know if you're approved to start using your benefits. Like I mentioned later in the presentation, the benefits team will talk about how we can use your benefits to receive any covered services and supports from a WalkCares provider. So benefits will become available next year statewide, but there are some key dates that we want to share with you all before then. So before the statewide rollout of benefits, we will pilot our entire system in Lewis, Mason, Thurston, and Spokane counties. That will be with a limited number of applicants, and residents of those counties can begin their application on January 6th. On April 1st, you'll be able to create an online account, which you can use to check your annual contribution statements, and that will also be where you will apply for benefits. And then on May 18th, applications for benefits open statewide. And again, on July 1st of next year, all beneficiaries can start receiving services. So starting in July of 2026, you can choose to continue participating in WalkCares if you leave the state. In order to become an out-of-state participant, you must have contributed for at least 3 years, where you are working at least 500 hours or more per year, and you must opt in within a year of leaving Washington. And just like other workers, out-of-state participants will keep contributing to the fund during their working years. And the process for out-of-state participants to be able to report their earnings and pay premiums is still being worked on, but the focus is making it as easy as possible for those folks to do that. And then starting in July of 2030, out-of-state participants will be able to access their benefits outside of Washington. And with that, I will pass it over to Janice.
Thank you. So once you've become eligible and are able to utilize your benefits, one of the ways that you're going to be able to manage those WalkCare Fund benefits is through your WalkCares account, which is that same account that you're going to utilize when you apply. Once you've been approved to use those benefits, you then are able to access this dashboard. And this dashboard is really going to be the main tool that you use when you're managing your benefits. And you'll see here that you'll be able to see your available balance. You'll also be able to see your pending pre-authorizations. The pre-authorizations work in that the provider that you choose to provide the services or goods would work with you on kind of what what services or goods that you need, you come to an agreement. They submit what we call a pre-authorization, which they submit, and then that pre-authorization is sent to you. And this is a screen that'll pop up when you get that pre-authorization. And the way that works is you actually are going to have to approve that pre-authorization before those services can be rendered and for that provider to get paid. So again, this is just a quick overview of what that dashboard looks like. Next slide, please. And this is just a close-up of what those different options are that look like on the screen. Again, pre-authorizations will pop up here, and then you approve or deny so that services can be rendered. Your available balance is there on the bottom. And then also notifications is on the screen where you'll be able to view notifications. And notifications can be things like you have a pre-authorization that you need to take action on. Maybe there's a form that's required. That kind of notification would be in there. And things like inflation type of information would also be in there. And one thing to note too is that when you're applying for your benefits, you do get to choose the mode of communication that you want to receive these notifications. So you'll get one here on your dashboard, and then of course like an email if you provide that.
Alrighty. So the next screen is describing for us how far exactly your money will go, your benefit that you've earned, that 36,500. And so for most people, we know that you need the care for a year or less. Most people that need care, it's usually for a year or less. For those people, depending on the services they choose, that Walk Cares may be able to cover all of their needs during the time that they need assistance. For others, Walk Cares will actually just provide your family with immediate relief and then also give you time to plan for future costs and how you're going to manage that as a family. Here's a breakdown of some of the examples of what you could use your benefit for and how long that might last you. So if you'd like to pay a family member for care, you can receive care for 10 hours a week for 10 hours and get care supplies such as incontinence supplies for under a total of $35,000. If you want to keep your home and stay and make it more accessible for you, you can receive, you could make home modifications that we've got there. I could build a ramp or widen some doorways. You could install a personal emergency response system, which is one of those I've fallen and I can't get up buttons that you push if you have a fall or something else is going on. Or you can make your home more accessible by doing that, as well as being able to get home delivered meals for 10 meals a week for up to 3 years and still stay under the benefit amount of $36,500. If you need short-term help after an accident, and you just need that temporary support, you could get in-home care for 20 hours a week for 6 months, install a ramp, and buy safety equipment and still be under your $36,500. So that would be a total of about just under $29,000. Next slide, please. So once you've been approved, you can use your benefits in any way you choose to meet, however will meet your needs best, as Sebastian indicated. And so you'll be selecting a provider from a pool of Walk Care specific contracted providers, and you can choose from the whole broad array of what's being offered in Walk Care's fund. So you may choose some services that would help you stay in your own home, and this list has some examples, such as having those home modifications like building a ramp, making a bathroom more accessible, widening doorways, those kinds of things. You could get those home delivered meals, such as Meals on Wheels or Mom's Meals, or you can also access adaptive equipment and technology and things that might help you stay in your home more comfortably and more safely. We also cover many services that support family caregivers in addition to supporting you as the beneficiary. You can get paid care from a loved one, even your spouse, or you can get respite care so that they can take a break. We cover education and consultation to help you and your caregivers manage your care. You can get dementia and behavioral supports to support you as you're going through some of your specific challenges. and care transition coordination that could help you when you're leaving a facility like a hospital and you're getting that discharge planning. You can choose to receive services in your community, like in an adult family home or in adult day services, like adult day health or adult day care. But you can also choose to receive your care in an assisted living facility or nursing home, and that includes memory care. Next slide, please. So there's a couple of different ways, several different ways that walk cares can support you with your activities of daily living. Sebastian mentioned what those look like. That's the transfers and mobility, eating, toileting, those kinds of things. And sometimes we need help with that. And so ways that you can receive that care while you're in your own home, you have two different options. One would be looking at a home care agency, and that's where you hire the agency, you pay the agency, and the agency is tasked with providing a caregiver that would be assigned to come in and take care of you in your home. So you would work with the agency to create a plan of care that meets your needs and your preferences, and then you work directly with them as your care may change. And you can get paid care from a family member if they work for that agency and they're assigned to provide your care. Another option that you might be familiar with is working with an individual provider. We refer to those as sometimes as our IPs. And you could find a provider, and then you would talk to them about how to go about becoming associated with Consumer Direct Washington, CDWA, or you can use an online database to help you find one if you don't have a caregiver that's available and is willing to help you out. All providers, individual providers do work for Consumer Direct Care Network of Washington, but you are in charge of supervising them and telling them how you prefer to have your care on a day-to-day basis. You assign their tasks, you set their schedules and their hours, and you work directly with those caregivers. And if things aren't working out, then you would also be the one that would end that employment and look to getting a new one, possibly from Consumer Direct Care Network of Washington. So we encourage you to create a care plan agreement with those providers as you work with those providers to stay in your own home while you're receiving that care. So we also offer options of receiving your care in a facility, a community-based facility, or a nursing home. So an adult family home is a home-like setting where a small number of people, it's usually 6 to 8 individuals, are receiving personal care, specialty care, and they receive room and board there. So these are homes that might be in a neighborhood. They probably look like a home that you would drive by going through any neighborhood, and you would be a resident in there with other people that are receiving care. We also cover assisted living facilities where you would be in more of like an apartment type setting. And so you would receive your basic services from them, which also includes meals, laundry, supervision, and varying levels of care depending on the facility. We also have the option of you receiving your care in a nursing home. So this would be custodial type care or long-term care in a facility. And so it would be 24 hours of supervised nursing care, which includes your personal care, people helping you with your hygiene and your personal care tasks. It might include some therapies, nutrition management, some organized activities, some social services, room and board, and laundry. Next slide, please. So then we have our personal emergency response system. These are also services that can help you stay in your home. And these are those buttons like we were talking about where I've fallen and I can't get up. And what you do is you wear it, either a lanyard that would be around your neck with a pendant, or it could be something that's on a watch. They have various different options, but if you need help, you can push that button. Some would actually detect if you've had a fall, and then that call center would respond by either contacting you or whoever you have set up to be their contact. You can also get medication reminders through a PERS and personal emergency response system. They can do wellness checks, and you can have set up a GPS locator if you have you or your loved one tend to wander and you have that as a risk. We also can arrange for home delivered meals. And so we would go to our registered providers and look to having meals that would come directly to your home that you would heat up and consume at your leisure. Sometimes they might come hot with like a Meals on Wheels type setup where they are actually delivered a hot meal and visit with you briefly on the porch and as kind of a check-in as well. So those are services that might benefit you as you look to staying in your own home. Next slide, please. Additional services that you can receive that might help you as you're looking to stay at home or to take some pressure off of your family caregivers is housework and errands. And that includes just general type cleaning of maintaining your home. They can help with laundry. They can help with changing your bedding and removing clutter around your home. Errands might include going grocery shopping and taking you on local trips such as to the pharmacy or to your post office. And so that's housework and errands, and that can be hired to assist you and as well as to take that pressure off of your caregiver so that they can dedicate more time to taking care of you or to so that they can not have to alter their schedule like Sebastian was talking about. You can also hire someone to help you with your yard work and snow removal. And that would be specifically to help you get in and out of your house with safety. And so they can maintain your lawn by mowing, trimming branches, clearing snow, and doing just general upkeep to take that pressure off as well. Next slide, please. So services that help you stay in your home also include a home safety evaluation. And that would be having someone come into your home. It's an occupational therapist or a physical therapist that comes into your home, and they would walk around with you and see how you manage your activities of daily living. And then they typically will make recommendations to you, such as maybe lowering your bed or removing rugs that might be a fall risk. They would leave you with a list of suggested ways to make your home more accessible and safer for you as you navigate your home. Sometimes that would be changing where some your lamps are plugged in to reduce fall risks, or lowering where you store your pan so you don't have to bend or stretch to get your cooking things out. So they would be making real life advice for you that would improve your safety as you live in your home. Other changes that could be made to your home would include bigger things where you might actually need some construction type efforts made. And so those are called environmental modifications. And typically that would be something that would be adding a ramp to your home if you your mobility has changed and you're recently using a cane or a walker or a wheelchair. They can also widen doorways to accommodate a wheelchair, make your bathroom more accessible. So there's lots of things that an environmental modification can do to help increase your safe living in your home. Sometimes these two services actually would go together. A home safety evaluation might recommend to you that you need to have someone install specific equipment like grab bars or a handheld shower, and that can happen either through just obtaining those goods and having someone in your family install them, but it also can happen by going through a registered environmental modification provider that would install those grab bars and handheld shower for you on your behalf. So a lot of times those do go together. Next slide, please. So let's see. We've got the respite for family caregivers. So these are other things that will support you and your family as you are receiving care from them. So respite can give your family sometimes a much needed break, or even just an opportunity for them to go about their work life if they have a business trip or something like that. So respite can help your family caregivers maintain their employment, but also gives them a break when they need a little break from the stresses of caregiving. And that can include receiving care from someone else in your home that would be a paid caregiver, or having somebody help you in a community setting such as an adult daycare, an adult family home, assisted living, or even in a nursing home for a brief stay. And you can use this service as much as you need to so that you have you can be providing that support for your family caregiver. We also provide adult day services, which would be adult day care and adult day health, which both provide supervised access to activities during the day and provide social interaction, which can improve your health and well-being. Adult day health also includes skilled services such as checking your blood pressure. They might help you check your glucose levels if you're diabetic. So those are working with medical professionals as directed by your healthcare provider. The next slide, please. Another thing that we provide in Walk Care's Fund is assistance with transportation. So that would be helping you. You could either be hiring somebody to help you get back and forth from the grocery store to your doctor's appointments or other medical appointments, to social service offices or appointments you might have with the Social Security Administration or like the Department of Licensing. So some of the appointments that you might need to make. They can also help you with therapeutic recreational activities. Some costs can be reimbursed directly, and those include mileage, bus passes, taxi scripts, parking fees associated with medical appointments, and ferry tickets. And so in some cases, you might hire someone, a registered transportation provider that can help you get back and forth. And in other cases, you may do those tasks on your own and keep your receipts and turn those receipts in to be reimbursed. Next slide, please. Additional supportive services, we sometimes refer to these as wraparound services, like you would wrap around a warm blanket to help kind of keep you comfortable. These supportive services, these wraparound services include adaptive equipment and technology, and these are items that we think of sometimes when we think about needs in our home. And so some things might be durable medical equipment, such as toileting assistance, so a commode maybe that you could keep in a bedroom, or a raised toilet seat to help you as you're taking care of those personal needs. But it could also mean getting a basket for your walker, or it could mean having a smart light bulb that turns on automatically when you enter into a room. So there's lots of different, wide variety of items that are available under adaptive equipment and technology, and those can be really beneficial to you as you're navigating changes in your care level and want to stay in your own home. Dementia and behavioral supports is another really important service if you or your loved one deal with dementia or other behavioral challenges. And so that's really working with a behavioral health specialist, a counselor, or a psychologist, or somebody that's credentialed to help you develop a behavior support plan. And that's really designed to help navigate challenges that might be in your home or in your setting, such as wandering or aggression or any other inappropriate behaviors, or even just learning how to de-escalate a situation that sometimes can escalate quickly, and just learning specific skills either for yourself or for your loved one as you're caring for a loved one. Next slide, please. So additional supportive services are that care transition coordination that we mentioned earlier just briefly. And that's really about supporting you as you discharge from an acute care setting, which would be a hospital, and occasionally it could be a nursing home. You would receive this service for up to 2 months after discharge. And really what these specialists do is they help you understand your discharge plan. So when you discharge from an acute care setting, often you're given a list of prescriptions to pick up and follow-up appointments you need to make. Those kinds of things. And so they would help to make sure that you're following up on all the things that you've been asked to do, with the goal of reducing the risk of a readmission. So that's the care transition coordination. Education and consultation allows you to get specific information about your care, your diagnoses, your chronic health conditions by someone that can help you navigate as you maybe have a new diagnosis or a new amputation or a new paralysis. They can help you to figure out what the best path forward is for you. It would also work if you have a chronic condition and your condition is not new, but I'm just having these challenges and I would like to have more information on how to even ambulate or walk through my home safely. What are some steps that I can do to change my approach to my mobility so that my fall risk is reduced? We also offer some evidence-based programs such as chronic disease self-management, where you learn skills on just navigating what could be a really challenging health situation. And so those are all designed to help you to be maximize your health and well-being. Next slide, please. So additional services are some very specific nursing services for individuals that need these. And so skilled nursing is a short-term treatment with a health care provider that would come into your home or your setting, and they would help you do things that you're unable to do by yourself, or that your family caregiver can't do as well. So some tasks that can't be delegated and have somebody else do based on the law, you would be able to have a skilled nursing, a registered nurse come in to help you with that. Nurse delegation provides the opportunity for a registered nurse to actually train one of your caregivers that's found eligible to do some nurse delegated tasks, so that they can help you with some items and some services while they're in your home, rather than having a nurse come in to do those. And so that's another very specific service that can help you stay in your home. Private duty nursing, individuals that need this service are typically very acute. They have high needs. They're typically individuals that are on some kind of a mechanical living situation, so they might be on a ventilator, so they need some specialized medical care. So this would allow a private duty nurse to come in to help with those needs specifically for a specific period of time each day, as well as to ensure your family around you knows how to operate and to maintain your health and wellness while you're dealing with those challenges. And then memory care is a program that we can offer in our assisted livings that can help individuals that have Alzheimer's disease or other forms of dementia as they navigate their future life and need to be having that level of supervision that would happen in a memory care facility. So that's the list of our supported services and our approved services for Walk Cares Fund. Maria.
Thank you so much, Debbie. And I will go over the our suggested services. So our suggested services are recommendations based on information that was collected during your care needs assessment. Your responses to the assessment will generate a list of suggested services from our covered services. These suggested services are informational only and are not required. Beneficiaries are not required to use the services that were recommended. Assessment specialists will review and update these suggested services during the assessment to ensure they're personalized and relevant to the beneficiary. Thank you. Next slide.
Great, thank you, Maria. Now we are going to be doing a live Q&A with all of our panelists. If you have any questions, please add them into the Q&A function at the bottom of your screen. And I will also be asking some questions that came in from the registration form. So if you added a question when you registered for this event, we will be going through those as well. So the first question, Sebastian, can you clarify how the benefit is adjusted for inflation and what that means?
Still muted. Yeah, so that's a good question. So the inflation adjustment is based off the consumer price index for the Seattle area, and that is established by the Long-Term Services and Supports Council by September 1st of each year. And then the adjustment that is determined will take effect on the following January 1st, right, for that following year. So that's how it's adjusted. And I think part of that question also was about maybe if someone uses their benefit amount partially and then has remaining balance left over, that balance will also be adjusted for inflation. If the beneficiary uses part of their benefits and then has a remaining balance, that remaining balance again will be adjusted for inflation.
And if I could just tag on to that, Sebastian, I think the last half would be, what if they've used their full 36.5? And I think if the benefit is fully used and has been exhausted, then there is nothing to adjust. And so if you think of the math that would happen, like if we say there's going to be a 1.4% adjustment, like Sebastian said, that would impact any remaining balance, but 1.4 times 0 would still be 0. So you would not get any additional funds added on to if you used your benefit completely.
Thank you. Debbie, I think this one's for you. Are care coordination service, or can you use your benefit to pay for care coordination services?
Yep, all of the services that we talked about are all services that you can use your Walk Cares Fund benefit for. That one is kind of interesting in that there are hospitals that do that, will help you do that as well. So, but we're going to be looking for organizations and registering with providers that can help you navigate that, especially if you're having a kind of a complex situation and you've been referred to lots of specialists, that kind of thing. So absolutely can come out of your benefit.
Thank you. Sebastian, do you need to work at the same workplace for 3 out of this last 6 years, or just be working for 3 out of the past 6 years?
Yeah, it does not have to be the same workplace. As long as that workplace is based in Washington, then you will be contributing to the fund and are contributing to the fund, and can earn benefits that way. But yeah, it does not have to be the same workplace.
Thank you. I'm going to ask some questions from the registration form. Maria, this one's probably for you. Do I have to use the services that are suggested to me?
No, you do not. Those are strictly suggestions, recommendations that are based off the information collected during the assessment. If you do not want to use those suggestions, you are more than welcome to choose any of the other covered services that are a part of Walk Cares.
Thank you. Sebastian, how do I know if I have met contribution requirements? Will my employer keep track of that? Should I keep track of that?
Yeah, so the contribution requirements are the 3 pathways, right, that we looked at earlier, starting on May 18th, April 1st, when folks can start opening their accounts. You will be able to see your contribution statements on your account, so you'll be able to see that then. But contributions began just for broader awareness as well in July of 2023. So if you can look at your pay stub as well to see if you are currently contributing, but starting in July of 2023, if you're working at least 500 hours per year, then you are earning benefits to be able to use later on when you have a care need.
Thank you. Will the amount that I contribute change over time, or will I always contribute the same amount?
The contribution rate of 0.58% is set into the law, so that that will not change unless the only way it can change is if there is that is voted on by Washington residents to change that amount. But that is set in the law, so that will be that is the current rate of 0.58%. Yeah.
Thank you. There's a question, what are the limits on the temporary benefit? I'm not sure exactly what you're referring to. If you want to clarify your question and re-ask it, that might be helpful. And then there's a question about using your Walk Cares benefit with other long-term services like Medicaid. I think if you submit that question through email, we can get back to you, and I'll drop the link in the chat for email, and then we can get back to you unless, Sebastian, you have a quick answer.
I have a quick answer if that's okay. Yeah.
Yeah.
So this is a really great question, because this is where coordination of benefits does kick in. And so you are making the right assumption. You will need to use your Walk Cares Fund before you would use your Medicaid. And so if you're already enrolled in Apple Health, there is some crossover with just a few items that are available under durable medical equipment. Under long-term services and supports available, like you've got MAC and TSOA in your question specifically, but it would also be for the COPES waivers and for Community First Choice. Walk Cares Fund, if you're enrolled in both, Walk Cares Fund will pay first. And so you can strategize as a beneficiary or as a loved one, your timing of which one you may want to enroll in. You're not required to enroll in Walk Cares Fund if you're already on services through Medicaid. So those are decisions that you can make independently, but you're absolutely right. Walk Cares Fund will pay first ahead of Medicaid.
Thanks, Debbie. Am I able to increase my contribution to increase the benefit amount, or is the contribution a set percentage that I can't increase? Sebastian?
Yeah, so yeah, thanks, Sam. Yeah, so the contribution rate is set again at 0.58% in that you cannot contribute more, right, from your paycheck. But there is the legislature just passed this last legislative session and is creating a supplemental private long-term care insurance market. And that means that folks who maybe use up their benefit, Walk Cares benefit, and still have care needs after that will be able to purchase additional coverage, again, using those supplemental policies, and can receive those policies more, they'll be more affordable than private long-term care insurance will be. So that is, again, from this last legislative session, and that is expected to go live as early as in early 2027.
You. Going back to some questions from the registration form. Debbie, are you able to give some examples of assistive devices and equipment?
Mm-hmm. Yeah, you bet. So assistive devices and equipment would include things like waterproof mattresses, if you're somebody that may be having some periodic incontinence. It would be incontinence supplies, like we've talked about. It would be assistive technology includes a lot of different things that are very helpful. So it could be as low tech as adaptive utensils if you have somebody that has a tremor or somebody that has lost their grip due to arthritis. It could be adaptive utensils, but it could be as high tech as a Ring doorbell so that somebody knows I don't have to get up and answer the door because it's my Amazon driver. They'll leave the porch, they'll leave the item on the porch and I do not have to rush to the door. So there's some technological things that will be very helpful. Depending on what the issues are, we will have some resources available that will help you as you're thinking through your specific situations. We've got things that might help you bathe safer, things that can help you cook safer, things that could help you eat safer and more easily with different challenges. And so we'll have some suggested items, and it's not a long exhaustive list. It's a long list, but it's not exhaustive. It just kind of gives you a place to start thinking about things.
Thank you. Janice or Sebastian, when am I able to start, or when am I able to create my account online and get in there and see my dashboard?
So folks can start creating their account in starting April 1st of next year. So then you'll be able to, starting on April 1st, start creating your account.
How long will the process take from the time the application is submitted until the client can receive care or services and supports? Debbie, do you have an answer for that?
Yeah, Maria might be better, but I'll take a stab
Yeah.
at it. Yeah, there's the two elements that they'll be checking for eligibility. There's the contribution determination that's made by Employment Security Department, and they'll be verifying that you meet the obligations as far as paying the premiums for the length of time required. And then there'll be that functional assessment, and that's where Maria is the kind of the expert on that one. And that's that, do I need the level of assistance? And do we look towards the 90 days to see that, yes, I do need that care for 90 days. Once those things are all verified, I believe you can just start receiving services as soon as you've been verified that both of those elements have been met.
That's correct. It is correct. And once you apply and the ESD makes a contribution determination and you have met a contribution requirement, you will be notified and DSHS will be notified, while CARES will be not notified, so that we will reach out if you don't reach out to us to make sure that to see if you're still interested in scheduling an assessment to ensure the process is still going, and that way we can get you scheduled and conduct an assessment and see if you're eligible and get those services in place.
Sebastian, can you go over about the pilot again if somebody is interested and lives in one of the counties?
Yeah, definitely. So, yeah, we are piloting our systems ahead of statewide launch in July 1st. So, between January 6th and February 28th of next year, folks who live in Lewis, Mason, Thurston, and Spokane counties can apply for the pilot. The pathways to the contribution requirement for the pilot will be the transition pathway and the temporary pathway that we reviewed earlier, and that is because contributions began in July of 2023. So that's the only two pathways that someone may be able to qualify for now. And then, of course, the care needs requirement that we talked about as well. So again, if you live in Lewis, Mason, Thurston, and Spokane counties, you can start applying January 6th through February 28th. You can call the customer care unit on our website. We have the phone number, and additionally, the area agencies on aging are assisting if someone needs further assistance.
Thank you. Can my benefit be transferred to somebody else?
So no, the benefit is not transferable, meaning so the person who is eligible is the one who met the contribution requirement and has a care need. That person is the one that will be receiving the benefit, and again, that benefit cannot be transferred to someone else.
Thank you. Maria, this one might be for you. The question is, who will be completing the assessments? I will say quickly before we answer, we do have a webinar that we did 2 weeks ago all about the assessments and the assessment process. I'll drop the link in the chat if you want to learn more about the assessment. But Maria, who is completing the assessments?
Question. We are hiring assessment specialists to complete the assessment, and we're also contracting and partnering with our AAA areas agency on aging, and with assessment specialists to conduct the Walk Cares care needs assessments.
Thank you. Sorry, I'm putting the link in the chat right now so you can find the recording of the past webinar if you are interested. I think that's all that we have for today for Q&A. If you do have a question, I'll also put the link so you can email us and we can respond to you directly through email if you do have another question. Next slide. As soon as you exit out of today's webinar, a survey will pop up on your screen. We'd love to hear your thoughts about today's presentation. If you could take a minute to complete that survey, we would really appreciate it. Next slide. As I mentioned, the recording of this webinar, as well as recordings of past webinars and registration for future webinars, is available on our website. If you do have a question and want to contact us by email, you can go to the link right here or call our customer care team. And you can also follow us on social media or sign up for a newsletter to stay up to date on Walk Cares. Thank you all for joining us today, and we hope to see you in a future webinar. Have a good day.